All right, you guys. So we are back at it again with Wellness Wednesday. Yes, Wellness Wednesday, where you have the opportunity to connect with a mental health or a wellness professional, get the information that you need, and be able to just continue to manifest and heal at the same time. So let's get started because I have this beautiful, beautiful young lady with me today who is going to bring so much information to you guys. That's really key, not only in our lives, our families' lives, our parents' lives, people in our lives. It's information that you can utilize to continue to bridge the gap and continue to move forward in building the legacies, the healthy legacies in our families. So, without further ado, I have the beautiful Miss Lisa. She's a nurse practitioner. She works with Aspire Healthcare, but I want to also say that she's a mother. She's not only a mother, but she's a woman that is continuing to work hard each and every day to not only connect families to the resources they need, but the resources that is going to help them sustain. So without further ado, Miss Lisa. Hey.
Hi, everybody. Thank you for having me on your show today. It's an honor to be here, and I'm excited.
Awesome. I'm excited to have you too and the information that you're going to bring. So I'm just going to jump right into it because I feel like we've been putting out the promo to people that they're going to get some information regarding how to connect wellness with their families. And let's just jump into it. So what is Aspire Healthcare? I know everybody is like, why does she been promoting this? Like, what is Aspire Healthcare?
So Aspire Healthcare is a program that exists to, just like what you said, bridge the gap between essentially patients and families and the greater healthcare world that they have to interact with. That is sometimes confusing and contradictory and difficult to access. So Aspire exists to try to be that support system and almost that last missing link between hospital and home and healthcare provider and home, because it's a lot different when you're face to face with a healthcare provider in an office and they're telling you what a plan of care might be, or what medications you might be being prescribed. But when you walk out of that office, there's sometimes a lot of unanswered questions. There can be barriers in place to actually executing those care plans. So Aspire tries to fill that gap, try to prevent hospitalizations if possible, but really just meet that unique need that can only be met when you're actually face to face in the patient's homes. And that's what we do. We provide care to not only the patients, but the families in the homes as well, to try to make care more simplified.
Yes, and I really want to hone in on the communication and that liaison piece. I've had the opportunity to work with Aspire Healthcare for my father. And, with my father illness and different things that he's going through, it was difficult. It's still difficult at times, but being able to connect with someone who's going to advocate to get the information that you need, simplify the information that you are getting, because a lot of times, sometimes we receive this information from doctors, rather it's routine healthcare, or you're going through serious illnesses, especially for our parents or those that we support, our grandparents or elderly, and that information can be confusing. So yes. I really, really want to hone in on the fact that that communication piece, that advocacy that Aspire supports with. Can you just give us a little bit more about like your specific role?
Sure. Yep. So I am what would be considered a community-based healthcare provider. So essentially, my day consists of doing face-to-face visits with patients and their families in the home. We do, of course, touch on the sort of nuts and bolts of healthcare, what medications you're on, who are your healthcare providers, those sorts of things. Try to remove any barriers that might be in place to accessing the healthcare provider or accessing medications. But really, more than that, we're trying to help families understand their own healthcare journey. And I know that that probably sounds really like broad based, but it is really broad based because people have such unique situations. They have any number of caregiving scenarios in place. Some people have no caregivers in place. So we really are expanding beyond just, what medications are you on? What are your illnesses? But, what is your care plan? What's important to you? What's important to your family? How can we support that? And that takes so many different shapes, throughout the course of the day and depending on the patient. So really what we do is everything, if that makes sense. There's really no like stringent formula that we follow because that's not how people are and that's not how families are. So we just sort of support where we need to
Mm-hmm.
and where we can, and we get really creative with that. We have a social worker. We of course have a physician that we consult with, and just doing whatever we can to support patients and families. And it really makes a difference when we're coming to the home because many of the patients are so unwell and so chronically ill that they can't really get out.
Mm-hmm.
So we may be the only people that they're seeing.
Yeah, and it's been such a blessing, and I'm definitely going to continue to advocate for anyone that is watching this and you are either helping a family member or know someone that's helping a family member who is dealing with a chronic disease or illness and needs just a little bit of help, needs just a little bit of support, someone to provide information, simplify the information, help to communicate to doctors for them, um, or just allow them to be at ease of mind and say, hey, I can do that on your behalf. And that's what I truly have appreciated about Aspire Healthcare is the fact that there has been times where I was tired. I got overwhelmed. And you sometimes it's scary to say that when it comes to supporting, you don't want to say that. Like
Yeah.
you get overwhelmed. But to know that there are resources out there to help you not get to that point. Or
Yep.
if you are at that point, there are still resources that can help to start taking those things off of you so you
Yep.
can move forward. So I really, really advocate for that. And I just wanted to dive into what you said was create that care plan.
Mm-hmm.
And care plan, so I'm gonna just be honest with y'all. Like when Miss Lisa brought up a care plan to me and my dad was just like, listen, going through those questions, it was so much paperwork. And like, let's be honest, we don't want to talk about what happens if I get sick.
Mm-hmm.
We tend to shy away from if I die or
Yeah.
what do I want? You
Yeah.
know, and that was a hard conversation to start to have with my parents, but it
Yeah.
started to be easier once we started because
Yes.
I started to understand them more. So can you give us a little bit more information about care plan and then also the paperwork or the name of the documents that are really important for people to have?
Yeah, so another piece of the work that we really try to focus on and that we really try to get families to kind of hone in on is what are your wishes? And those, like you said, are difficult questions. First of all, they're difficult questions to ask. It's definitely not something that I was comfortable with initially. And they're difficult questions to answer because just like you said, we are, well, I'm paraphrasing what you said, which is that we're a very death avoidant culture. That is just how the United States is, because we're, we are supposedly a leader in medicine and healthcare in the world, and we are very pharmaceutically based. So the care here is very much focused on life prolongation without really addressing the quality of life. Yeah, you may be prolonging the life, but what is the quality of life? And that's just something that, we as a culture in the United States need to get better at. And I think we are getting better at that. So specifically, what you're referring to, and the documents that we're encouraging families to read through and fill out, are things called advanced care planning documents. They have many different names. It's different than a will, where you're sorting out your physical goods, but this is an advanced care planning document where, whoops, sorry. Oh my
No,
goodness.
you're back.
Are you there? Okay.
I'm still here. Still here.
These are documents that you specify who you would want to make decisions for you if you were not able to make decisions for yourself. And, jotting that down in a legal document can relieve so much family drama and stress. When you get to a crisis, unfortunately it happens. We hope that it doesn't, but if there is a healthcare crisis, it certainly lessens the trauma of it if there are already these plans in place and there's already a decision maker in place. We really encourage people to specify their wishes about things like resuscitation, CPR, being put on a ventilator. These are all things that we really encourage people to think about, because it's much easier to discuss it with your family while you can, of course. And no one wants to leave their family burdened with these types of hard decisions. So we try to work to remove that death avoidance. I know that probably sounds blunt and a little bit depressing, but the fact is that none of us are getting out alive. And if we can have more, in the end, we're all passing on. And if we can have more control over that, if we're not just at the mercy of the healthcare system, and we can say, the quality of my life is important to me, the time that I spend with my family is important to me, I want to have more control over that, and I want to get my wishes down in advanced care documents. Mm-hmm. It's very actually simple to fill them out. Aspire provides legally binding documents in the state of Michigan. And, we just, whether or not the document ever even gets completed, if we just get that conversation started with a patient and their family, I consider that a success, because sometimes, in spite of an individual being a very, well-connected user of the healthcare system, sometimes we are asking them this question for the first time. What are your wishes? What is important to you? And that's a problem. This is something that healthcare providers should be talking to their patients about. So I hope that answered your question. That was a very long-winded answer.
No, it was not long-winded. I think it was very informative, because I just go back to that moment of being, okay, I wasn't 30 just yet, but I remember, like, my dad he's in a much better place now, but he was, it was at a scary place. It was at a really scary place that we were at. And that question just was like, what if? And all I kept thinking was like, I don't know how to have this conversation. Yeah. And with both of my parents. But after having that conversation, it allowed me to understand them more. It allowed us to go deeper on things. And it opened up some doors for that conversation to continue in other areas too, including because there's so many other documents when caregiving. It's so important that you are aware of, whether it's a power of attorney,
Yep.
advance directive, and if you can give just a brief information about those two.
Yep. So a healthcare power of attorney is essentially the same thing as a patient advocate. And this is a person that has to be over the age of 18. And when you designate who your healthcare power of attorney is, you have to have it witnessed by someone that is over the age of 18 and that is not related to you and is not a healthcare provider. And that is basically the extent of designating a health care power of attorney. I think people think it's something, really confusing or my daughter's leaving. Bye. Or cumbersome, or it's very detailed paperwork, and it's really not. I mean, I think you looked that over and you saw that it's essentially, a page or two. So healthcare power of attorney designation is the same thing as patient advocate designation, and it's really quite simple. Advance directive. So this is a document that is more of a deep dive into specific wishes. And those types of things that are spelled out in an advance directive are what type of end of life interventions would you be willing to accept, and what would you not be willing to accept? And these are things such as dialysis in the event of kidney failure, CPR in the event of respiratory arrest or cardiac arrest, being put on a ventilator, receiving blood transfusions, artificial feeding methods, and, all the way up to a DNR, which is a do not resuscitate, meaning you would not want any interventions. So these are the things that an advance directive touch on, and something that Aspire works with people to, help them sort of tease out with their family.
Okay. I really appreciate you going into depth with that.
Yeah.
So how could someone reach out to Aspire or to get more information? Is there a way for them to connect?
Yeah. So Aspire is actually a program that people can self-refer to, meaning this doesn't have to be something that a doctor, refers you to our program. So an individual can actually just call a number that I can provide to you. There are certain health insurance plans that we work with. So, depending on what the individual has, then our office can simply verify eligibility. And of course, there has to be some type of chronic illness or serious illness that makes a person eligible for the program, along with their insurance eligibility. And if those things line up, the program is free, and it includes approximately once a month visit from a nurse practitioner, which is nice because we can prescribe medications and we can diagnose acute issues. And then there's 24-hour access to on-call service, so that people can, kind of troubleshoot or, pick our brain. Hey, is this something that I need to go to the hospital for? Or I've run out of a medication, or I just need someone to talk to. I'm totally overwhelmed. And this is not just our patients. Many times it's family members, that are in that caregiver role, and they are just burnt out and they feel totally alone. And oftentimes they're calling us just to say, I'm struggling. So all that said, if someone wants to self-refer or, see if a family member is eligible for Aspire, We have a local phone number that's, it's toll free, but they just gave it a local area code, 313-768-9101. And all you have to say is, I'd like to know if I'm eligible for this program. I'm interested in it. And that's it.
So I know it was like, all right, Tay, we jumping into this. We're going right into how can I get these resources? You give me all this information. But I really, really, really push this information to anyone who just needs a little bit of help in supporting or just needs help for themselves. A lot of people already know, like my dad has battled cancer throughout my life. And it got to that point where it was really scary. But if it wasn't for Aspire stepping in and starting to simplify things as far as information, if it wasn't for Aspire, really Lisa, really Lisa being able to just connect with me and talk with me and help me to understand. And I knew that somebody had my dad's back at the end of the day. At the end of the day, I think that was the most important thing that I took away from this resource, was knowing that you had a genuine program that would go to the end for you. They wouldn't just stop at, oh, I can't get the information. They would utilize their resources as best as they could to find out as much information as they could and explain it. That was the key point of explaining, because medical terms.
Oh yeah. Yep. Yep. And that's like a perfect example of why we exist, because if we can, just provide some empowerment of understanding, that's huge. That goes a really long way, because what I find is that, people really seek to understand. Of course, they seek to understand what's going on with them. They really want to understand their treatments. The families want to understand the treatments. But as we know, with COVID and just in general, appointment times being really short and typically really rushed after usually, an hour-long wait in a waiting room, you really lose the confidence and the energy and the will to really ask those questions that are swirling in your head. And that's such a common situation for patients and families. And so when we can come in, in the comfort of your own home and say, let us kind of be that question asker and that information gatherer, it's huge. I think sometimes when we initially get involved with a patient, they say, well, what are you going to do for me? I already have a doctor. I have all my medicine. What can you do for me? And I think they find over time that they didn't know that what we do was missing from their life. Do you know what I'm saying? Because I think people are so used to just sort of being shuttled through the healthcare system and kind of feeling like they don't have control. They're kind of at the mercy of the healthcare system. And we try to give that control back, and that's so important. Like, you don't know that that's missing until you have someone to kind of guide you and walk beside you, if that makes sense.
No, I think that was perfect to kind of as we're bringing it together, a person to walk through. And I think we touched on that in a lot of different areas when we talked about wellness, or we talked about testimonials that people have shared in the last couple of weeks. But it's really about being able to walk through this life with someone and knowing that you don't have to do it alone,
Yes.
And a lot of times when it comes to wellness, we don't think, okay, that we're going to have a doctor, we're going to have a nurse practitioner, or someone in our healthcare system is going to walk with, but that's what you should see. And that's what you should actually have. That is something that is so important when it comes to wellness, is that you're not just being shoveled through.
Yes.
But you're actually understanding, and there's somebody walking alongside you.
Yes.
I want to, as we're bringing this to an end, I know we talked about a plethora of stuff and we talked about how they can get in contact. But I want to just, I guess, end with what would your advice be for someone, or encouragement be for someone that is a caregiver or who is maybe watching this and they're actually going through those illnesses or chronic illnesses? Just some words of encouragement for them to continue to move forward and knowing they have the opportunity.
So I would say that caregiving is probably the most challenging role that someone can take on. There's typically no direction. You don't really know how to caregive. I mean, yeah, in some ways it comes natural, but typically when roles are reversed, when the child is now caring for the parent, or a spouse, caring for their spouse when they used to have a partnership, that is probably the most challenging role for people to slip into. And so first I would say to people, give yourself some grace. This is a really difficult role. You don't have to love it all the time. It's okay to get angry. It's okay to get frustrated. It's okay to wanna, take a spaceship and never return. I mean, all those emotions are so normal. So I would say, be patient with yourself in the caregiving role, be loving with yourself. I know we all say, oh, take time for yourself, but seriously, take time for yourself, and if that means that you focus your efforts on finding caregiving resources, whether that's through the veterans or, certain programs that are available, those little hours away can be huge. Caregiving is no joke. So that's what I would say to caregivers. Just, you're incredible what you're doing. Yes, you are doing a good job. Yes, you are good enough. There's a lot of doubt in caregiving. So I just want to say to all the caregivers, you're incredible, you're amazing, you're doing a good job. And to take time to take care of yourself. And, as far as trying to navigate the medical community, don't get discouraged and don't get backed down. Be that squeaky wheel, meaning ask those questions, call that office a million times. If your gut is telling you something about a loved one's care, trust your gut and, don't let up, because I can tell you, I'm on the other side. I know the ins and outs of the medical community. There are many situations where a persistent family member or a persistent caregiver changed the entire course of, a person's treatment for the better. So I would just say, don't let the medical community intimidate you, and access the resources like Aspire to, help you navigate all this. That's what I would say.
Okay, look. I mean, because you hit on some key points. Really give yourself grace, care for yourself.
Yes.
And don't get discouraged. Don't get discouraged.
Don't get discouraged. Yes.
For everyone. And like I said, if you happen to stay through the whole entire show, you don't know someone that's, or if you aren't someone that's caregiving, but you know somebody that is, or know somebody that's going through some things that could really use this resource, please pass it. It's all you have to do is just share some information.
Yes.
If someone takes it, they take it. But if they don't, at least you tried, and at least you put it out there to say, hey, you don't have to do this alone.
Yes. And you don't. That's absolutely true.
So I just want to say thank you. Thank you.
It's my pleasure. Thank you so much.
Awesome. And until next time, you guys, which will probably be next week. All right.
Thank you for having me.
Thank you. Bye.
Bye.